Injector episiotomy. This video aims to demonstrate identification of haptic entrapment and a technique to release the haptic undamaged. With the advent of phacoemulsification and implantation of foldable intraocular lenses becoming a day-to-day procedure worldwide, numerous complications accompany it. Haptic entrapment being one of them. Entrapment of haptic is an uncommon but not a rare complication related to injection of foldable intraocular lens. The IOL haptic gets entrapped within the injector due to defect in the injector, faulty loading process, and other uncommon unknown reasons. Most often, it is the trailing haptic that gets stuck between the wall of the cartridge and the plunger, resulting in broken haptic and decentration of IOL. Identification of this problem begins from the time the lens is being injected through the main section. In our case, a 65-year-old lady with senile immature cataract in her left eye was planned for phacoemulsification and implantation of acrylic single-piece foldable intraocular lens. During surgery, the emulsification process was uneventful. However, difficulty arose during the IOL implantation. When we started to inject the lens through the main clear corneal section, the lens failed to move easily into the bag and moved backward with the nozzle and remained at the section even after the plunger had been pushed to its maximum extent. At this point, we halted for a while, observed the status of the trailing haptic inside the nozzle of the injector. On confirmation that the haptic is unbroken, the nozzle of the injector was cut open in downward direction with a MVR blade, taking precautions not to injure the haptic. This technique enlarged the opening of the nozzle and facilitated release of the haptic with McPherson's forceps undamaged. The IOL was then successfully implanted inside the capsular bag. Advantages of this technique are salvage of an intraocular lens, no additional instrument is needed, preventing series of complications that occur if the problem is unidentified, like broken haptic and decentration of IOL. Good visual recovery in immediate postoperative period, hence meeting the high expectations of patients undergoing cataract surgery.